Hello, it's Rafael Gutierrez, and today I'm going to finish off the Bubishi points. And one of the things that I will say is these are not points that you want to play around with. This isn't something that you want to try to do, okay, I'm going to hit as hard as I can to see if it really works. Some of these points, if you actually do them, especially the ones on the leg, you can actually end up causing a lot of damage. You can end up causing someone's, uh, pretty much interfering with someone's ability to walk. Now, are these points important if you're dealing self-defense? I would say yes, because these are points that obviously have a clinical reason for being there. And I know that there are some people who don't like the way I did this because some people in martial arts, and not just in martial arts, but a lot of people like to have magical thinking. And what I mean is they want to believe in, oh, well, if I meditate under a waterfall, I'll be able to cure cancer. And the truth is, things actually work the way they do because of how they are. One of the things that people forget is we live in a time where, at least in the U.S., life expectancy is 80 years. Uh, for women, it's a little older, but and for men, I think it's technically 79, but 80 on average. Now, you think about this: 80 years is a life expectancy now. It used to be 70. It actually, at one point, for most of human history, it was about 30. Some of the time periods that we start talking about, oh, people living healthier longer, they were only living about 40. To give you an idea, the retirement age was actually set initially when they started doing retirement programs at 65 because most of the workforce would be dead by about half the workforce would be dead by 60. And so what you're talking about is for most human history, we weren't reaching the ages we are now. And that actually explains a lot. For instance, a lot of people ask, why are we seeing a lot of Alzheimer's now? Well, before, most people weren't reaching the age of 60, so they never ended up having to deal with Alzheimer's. They were dead before that. A lot of heart attack, for instance, we're getting now. Probably has more to do with people reaching 50 rather than, most of the other things that we're dealing with. Now, I'm not saying that, oh, well, hey, there's nothing you can do about. You're just going to die of a heart attack at 50 if you regardless of what you do. No, I mean, we've actually found that exercise, diet does play a role in this. But that's one of the things that what I want to point out is one of the things that science has given us is longer lifespans. It's also given us a lot more. For instance, if you think of all the technology we use, even this right now, I actually can record myself on a computer. And people can watch me from various places in the world. I've actually seen some people have seen me in Japan, which hello, I actually do love going there. Some people have actually watched me in Spain, which I thought was really neat. Actually, had a couple people in Africa watching this, which for me it's actually kind of nice. And if you are watching this from any country, please let me know where you're watching, country, state, prefecture. It'd be really nice for me. I actually like to see where people are watching me from, and it'd be, well, for me, like I said, just leave a comment and let me know, hey, I'm watching from San Diego, California. If you're at San Diego, let me know because I really would like to meet. I love meeting martial artists. But the thing is, like I said, I tend to use science to determine what's going on because it works. Like I said, we actually are reaching life expectancies of 80 when most of the time we haven't reached half of that. I mean, someone who was my age in most history, I'm 42, in most of human history, I would be dead by now. And some people say, well, no, not really, because of most of childhood. Well, that's true. A lot of the things that killed people were childhood diseases, such as polio, mumps, measles, rubella. But you have to remember, people who get killed by infections are either the young or the older. And the older, they're usually talking about over 55. And you think about it, someone who's 55 nowadays, actually even someone who's 70, probably doesn't consider themselves that old, especially if they're active. And in martial arts, I know a lot of people over 70 who are active, and really, I don't think they should consider themselves old because they're able to do a lot more stuff than I can do. So, one of the things that I'm saying is our life expectancy has gone up because of a lot of different things, main one being science. And so that's what I tend to use to evaluate stuff. Now, have been time periods where religion and magical thinking were the ways. And if you look at, for instance, medieval Europe, which was when people had really big magical thinking, people weren't living to 40. And so the idea of, well, we're going to go in the past and they're going to have the answers. They might have some answers. I mean, there are some places in the world where people lived a long time. Now, I know some people will tell me, well, no, there's legends that people live 2,000 years. I read that. And what's funny is, in the year that the people were living 2,000 years, supposedly, was before writing. And also, so before any written record, people were living supposedly over 2,000 years. And life expectancy was in the 30s. So you can see how reliable those numbers are. A lot of times, though, it may not be, the story may have been changed. What I mean is, someone wants to say this person lived a long time, and so they add years. Now, like the fish story, you may have caught a fish this big, but you want to talk about how big it is, and it comes up. Now, I have one fish story. I used to live in Missouri, and I had a fish which I fought, and I was thinking this thing was going to be a monster, and I ended up being a catfish about this big. And I'm like looking at this thinking, how does this thing, but nobody wants to hear about my fishing story. So the big thing is, with science and documentation, we can see how things work. We can see life expectancy going a certain way. We can see how society progresses. Like I said, you think about it, my creative studio is my laptop and wherever I choose to sit. And that's it. That's all I need. Before, I would need expensive cameras that would probably cost $2,000-$3,000 when the average person maybe made that in a year. Now we can actually use computers, which are I think mine's expensive. I got mine for $600, and that's enough for me to be able to just talk to you and give you my ideas. Now, a lot of people disagree with what I say for a lot of reasons. Some of it is science, some of it is different techniques. And one of the things I will always say is there are different techniques. There's different ways to do stuff, and a lot of stuff works. But a lot of times for me, I want to test everything out. And for that, I use this guy over here. This is my mucky worm. It's actually, I'm going to drop this so you can see. It's actually on a wooden stick. You have the metal base and the two 2x4s here. You'll notice that it ends here. And this way it doesn't break on me. And so the idea here is when I punch, I actually have to put a lot of pressure to get the movement. And it's going to recoil back with as much force as I hit. Sometimes it feels like more. And so there's ways that I have to act so my fists don't break. You notice that I do use a straw rope, and I'm talking about a lot of different things that don't necessarily apply to Bubishi. But all I want you to know is that yes, I do test everything I say on this, or if I can't, I use clinical data and find out what could actually happen. So with that, let's start with the leg. Now, one of the first things we'll actually see, and I'm actually using my little anatomy book, which I'm in the process of revamping and renaming, mostly because it's now about 200 some pages and I'm still not even done. But here you can see that there's a triangle in the leg. Now this muscle here is called the sartorius, this one's the adductor longus, and the ligament here is called the inguinal ligament. In that little triangle here, which is called the femoral triangle, we have a vein, artery, and nerve. And I did a video on Arakaki's toe kick and how it ended up sending someone to need surgery. And what we found is, yes, it is possible. There's a lot of things called pseudoaneurysms. And if you want to know more about it, just look up the video and you can see what I talked about. But pseudoaneurysms are one of the big things that I noticed with a lot of the Bubishi points that that are shown in the leg. Now, and that is one of the big ones. If you look at it in most books, you'll have that one there. Now, the other thing I actually noticed is some of them have, if we have the leg here, by the way, this is medial, middle, this is lateral, so the outside. Some of them have a point right here. Now, if you kick the leg here, it's actually can tear the knee apart. The knee is really made up, what holds the knee together isn't the muscles, and it's not even the bones. It's a collection of ligaments. And when you kick it there, what can end up happening is you can end up tearing the ligaments there, called the unhappy knee triad is what it's called. If you If you want to know more about it, you can Google the unhappy knee triad and see what it is. Now, is that a disabling blow? Well, that kick is the reason why clipping is illegal in American football. That kick, what it does is it ends up pushing the leg straight and then pushing it inside to the inside of the body, and your body ends up shredding your own knee. It doesn't matter about the force. Well, you need a certain amount of force, I will mention that, but the force isn't as important as the mechanics of the kick. And there is a video in here about that kick. And yes, again, you're talking about something that's disabling. You think about it, if you're in a fight and someone cannot stand or use their lower leg because their knee is completely disabled, you have a really big advantage. The other one that I tend to find a lot is in the back of the knee. Now, some people say you can knock someone out by kicking them in the back of the knee. I tend to be hesitant on that because I have never seen anyone get kicked in the back of the knee and get knocked out. And clinically, the only ones that I've seen that happen to are the people who are students of those who think that if you kick the back of the knee, you're going to knock someone out. So here we actually can see the back of the knee. Where you can see, let me hold this here so I can bring it closer. You can see as I drew the artery in here in red, you can see this green thing is one of the nerves. Now, a kick to the back of the knee, again, over there you can feel a pulse if you press hard enough. A lot of times the nerve that goes back there might not let you because it is painful. And that nerve, when you kick there, you can actually tear the nerve or you can tear the artery, causing a pseudoaneurysm again. Either way, what you're going to be doing is you're going to make the knee relatively useless. Now, there are two other points that I noticed, and those were on the inside and outside of the ankle, in an area called the malleoluses. I'm going to show you just the bones on that one. So, if you look at the foot here, I use, by the way, fair use images. So, you see this little bump here, and you see that on the other side. Now, if you actually kick on that side, especially holding someone, pulling someone in, you can actually kick it, cause the ankle to rotate, and that can end up leading to something called a Pott's fracture. Pott's fracture can sometimes tear both of those big lumps called malleoli off, and you now have a completely worthless ankle. You can't stand because any shifting or movement causes it to move out of the way. And so what we have actually now done is we've covered pretty much most of the general Bubishi points of the legs. I know it wasn't as long as the chest and head, mostly because there was a lot more on the head. If you notice, one of the things that's interesting, that I find really interesting, is if you go into medical texts, most of the more dangerous hits, most of the deaths caused by blood trauma are to the head and chest. Abdomen, there's a couple of little points, but usually it really doesn't cause death unless you rupture a spleen or liver. And so what you notice is the Bubishi points actually tend to have a lot of clinical data supporting them. Now, a lot of times people will look at them and they won't really pay attention to them. They'll say, well, it doesn't work because it's just magical thinking. Because they keep on hearing this, oh, well, you hit gallbladder number 12, and they're talking about someplace in the ankle. Now, I don't know if that's a Chinese medicine point. It might be. But in clinical anatomy, we don't see that, the gallbladder in the foot. We see nerves going other areas. And I'm not going to, like I said, I'm never going to Chinese medicine because I honestly do not feel qualified to talk about it too much. I don't practice. I never studied it. And so I'll leave it to those who are qualified to do that. The sad part is we don't have many people who do clinical medicine coming out and saying how and what these things work. And maybe in part is because they don't see it that way. I don't know. Like I said, I don't practice Chinese medicine. All I can talk about is what we see in clinic, what we see in records and medical records, what we see in a peer-reviewed journal. And remember, this type of thinking, where we actually look at stuff, look at the evidence, and work on that, has increased life expectancy. It has increased the quality of life. I mean, you think about it. If you read books from Charles Dickens' times, they talk about how thick the air is and how people are getting sick and coughing up a lung because of the amount of coal in the air. Well, I live in San Diego, which has a lot more people than a lot of these old coal towns used to have, and we're not dying coughing up a lung every time we walk out. There are some places that are industrial that do have a lot of air pollution, and we see kids and elderly having more lung problems and have to go to hospital more. But that's the case. If you are actually in areas that do have a lot more pollution, you do have more problems, and we now know this, and so we can try to fix it. So with that, I'm actually done. I hope I didn't ramble too much and lose any of you. Please leave a comment and subscribe if you like this, and I'll probably see you next week. Bye-bye.